Welcome to Pediatric Case Review. In this episode, we'll dive into the clinical manifestations of pulmonary disease and cystic fibrosis among pediatric patients. Let's begin. Case number 1. A 12-year-old female with cystic fibrosis presents with a persistent cough that has become productive over the last few months. She also reports wheezing, especially during physical activities. On examination, she has decreased breath sounds and wheezing. What is the likely cause of her symptoms? A. Acute exacerbation of cystic fibrosis. B. Bronchiectasis. C. Airway hyperactivity. D. Normal respiratory variation in CF patients. The correct answer is C. Airway hyperactivity. The patient's symptoms, including wheezing, suggest airway hyperactivity commonly seen in CF patients, which is initially responsive to bronchodilator therapy. Case number 2. A 16-year-old male with cystic fibrosis undergoes a high-resolution computed tomography or HRCT scan as part of his routine evaluation. The HRCT reveals saccular bronchiectasis. What does this finding indicate? A. Normal lung architecture in CF patients. B. Advanced cystic fibrosis with irreversible lung damage. C. Acute exacerbation of cystic fibrosis. D. Mild lung disease in CF patients. The correct answer is B. Saccular bronchiectasis is a late-stage finding in cystic fibrosis, indicating advanced disease with irreversible lung damage. Case number 3. A 14-year-old male with cystic fibrosis presents for a routine checkup. His chest radiograph appears normal. What is the significance of this finding? A. It indicates advanced lung disease. B. It suggests the need for immediate HRCT. C. It is a typical finding in young CF patients. D. It is a reassuring finding in a patient with mild disease. The correct answer is D. A normal chest radiograph in a young CF patient is typically a reassuring finding and may indicate mild disease. Disease progression varies, and not all patients show radiographic abnormalities in early childhood. Case number 4. A 10-year-old child with cystic fibrosis presents with recurrent episodes of bronchiolitis, tachypnea, and wheezing. His symptoms have been ongoing since infancy. What is the likely cause of his early respiratory symptoms? A. Normal respiratory variation in CF patients. B. Acute exacerbation of cystic fibrosis. C. Airway hyperactivity. D. Chronic bronchitis. The correct answer is C. The patient's recurrent bronchiolitis, tachypnea, and wheezing from infancy suggest airway hyperactivity, a common finding in CF patients. Case number 5. A 16-year-old female with cystic fibrosis undergoes pulmonary function testing PFT. Her results show a decline in FEV1 and an FEV1-FVC ratio below 70%. What is the significance of these findings? A. Her lung function is improving. B. Her lung function is stable. C. She has mild lung disease. D. She has severe lung disease with airflow obstruction. Correct answer D. A decline in FEV1 and an FEV1-FVC ratio below 70% indicates severe lung disease with airflow obstruction in cystic fibrosis patients. Case 6. A 6-year-old boy with cystic fibrosis presents with recurrent sinus infections, nasal congestion, and a persistent cough. He also experiences salty tasting skin. What is the likely cause of his symptoms? A. Acute exacerbation of cystic fibrosis. B. Allergic rhinitis. C. Chronic sinusitis. D. Cystic fibrosis-related sinus disease. The correct answer is D. The patient's recurrent sinus infections and salty tasting skin are characteristic of cystic fibrosis-related sinus disease. Case number 7. A 14-year-old girl with cystic fibrosis is experiencing diarrhea, abdominal pain, and poor weight gain despite a good appetite. Stool analysis reveals steatorrhea. What is the most likely underlying cause of her gastrointestinal symptoms? A. Acute exacerbation of cystic fibrosis. B. Irritable bowel syndrome. C. Pancreatic insufficiency. D. Gastroenteritis. The correct answer is C. The combination of diarrhea, abdominal pain, poor weight gain, and steatorrhea is suggestive of pancreatic insufficiency, a common gastrointestinal complication in cystic fibrosis. Case number 8. A 16-year-old male with cystic fibrosis has been experiencing digital clubbing of his fingers and toes. What is the likely explanation for this physical finding? A. Acute exacerbation of cystic fibrosis. B. Chronic respiratory acidosis. C. Gastroesophageal reflux disease or GERD. C. Chronic hypoxia. Correct answer D. Digital clubbing is often associated with chronic hypoxia, which can occur in advanced lung disease, including cystic fibrosis. Our last case today, case number 9. An 11-year-old boy with cystic fibrosis is experiencing increased fatigue, muscle weakness, and excessive thirst. Laboratory tests reveal elevated blood glucose levels. What is the likely explanation for his symptoms? A. Acute exacerbation of cystic fibrosis. B. Dehydration. C. Cystic fibrosis-related diabetes or CFRD. D. Electrolyte imbalance. The correct answer is C.
The patient's symptoms and elevated blood glucose levels are indicative of cystic fibrosis-related diabetes or CFRD, a common complication in CF patients.
Thank you for joining us on this journey through the clinical manifestations of pulmonary disease in cystic fibrosis. Stay tuned for more pediatric case reviews, and remember to like, subscribe, and share for valuable insights in the field of pediatrics.